Summer of 2014, I lost about 20 pounds in August. Unexplained weight loss was my number one thing. I was worried. Actually, I was worried about colon cancer specifically, so I saw my physician. October 31st of 2014, I had my colonoscopy, and that's when I was informed that I did indeed have colon cancer. So I don't even think it was 10 days from my original colonoscopy. I was actually receiving chemo and radiation therapy.
Craig took the chemotherapy very well and was able to keep busy with his dental practice, and his treatment went really well.
I had two 11-year-olds, twins, and a 13-year-old and a 15-year-old. I had patients to care for. I had other plans. So it's pretty unexpected when everything gets put on hold and your number one job suddenly becomes treating your cancer. Well, a year out from the original diagnosis, I went in for my CT scan to just make sure everything was okay, and that's when Dr. Merchant found a spot on my liver confirming a stage 4 diagnosis.
And I had been looking at Craig's scans all the way through and noticed there was a subtle change in his CAT scan, and I asked for a biopsy of that area, and that's what showed that there was actually a small amount of cancer in the liver.
He saved my life at that point. If he hadn't found that spot on my liver and I had gone another year without treatment or investigation, who knows what would have happened. Being treated at Mary Greeley allowed me to keep my daily life normal. There wasn't a day that I missed treating my own patients. I didn't miss sporting events for my kids. Two of my boys and I do ski patrol over in Boone, Iowa, and even during treatment, Dr. Merchant always assured me that as long as I was feeling well, I could keep a normal lifestyle. I'm now over 3 years out from my last tumor removal, and there's no evidence of any cancer at all.
It's been so rewarding to take care of Craig, and just like all my patients, I've gotten to know them as people and really value his friendship. It gives me a lot of gratification to know that we were able to help him, at a critical time in his life.
Whenever I was in the hospital at Mary Greeley, whether I'd be admitted, the emergency room, the ICU, the Bliss Cancer Center, I visited it all. I always felt like I was being treated at home. I always knew that if I was at Mary Greeley, it felt like I was at home. I always wanted Mary Greeley to take care of me. I knew it would be okay if they were involved.